So Andrew Yang has decided to back out of Medicare for All. He no longer supports it, and he has come out with his own plan. And you're probably thinking, hey, maybe he has his own single-payer plan that he wants to introduce. Maybe he wants to do something like the NHS or like the French system or something like that. Canadian system, I don't know. Maybe he's got some ideas. No. He wants a public option. Where do I even begin with that? You can't have a good system. You can't have a good public healthcare system when you still have the private insurance companies. You just can't. Their mere existence is what corrupts the system that we have now. So let's just go over some of his plans. Let's see what he has to hear. Maybe there's something we can learn from this. Maybe he has some good ideas in here. I have some stuff written down here. So, he says he supports the spirit of Medicare for All. So basically what he's saying is he wants everyone to have health care, he just doesn't think Medicare for All is the way to do it. He says eliminating private insurance isn't realistic. See, something tells me that that's just not true. Because, I mean, every other developed nation, every other industrialized nation, they all have universal health care. They don't have private insurance companies, so how did they do it? I guess it's a mystery we'll just never find out. Here are the bullet points he provides. So, negotiate drug prices, invest in technology to make health services function efficiently, offer flexibility to providers, educate ourselves in preventative care, expand on comprehensive care, and diminish the influence of lobbyists. Okay, so we're going to break down a few of these points. Negotiating drug prices. You have to do that. I mean, there's no way a little vial of insulin should cost hundreds of dollars when it costs $6 to make. And if I were to take a bus down to Mexico or up to Canada, I could get it for $35. There's no way. There's no way it should cost as much money as it does. He's also talking about using telehealth, which is this technology basically that allows someone like a doctor from like California to talk to someone like me all the way here in Alabama, and he's able to diagnose me accurately. That's basically what telehealth does. It's a very bastardized, bare bones, basic version of it. Transition doctors from commission to salary. So basically now it's the way it works now, it's like fee for use. So if you get this surgery, it's going to cost this much, and the doctor is going to get paid this much for doing the surgery. He wants to transition it to where it's purely salary only, every single doctor. Now, that could actually work. I agree with that. I actually kind of like that. It kind of gets rid of them wanting to do any unnecessary procedures. It kind of incentivizes them just to go ahead and fix you instead of going through 2 or 3 different things just to bring the cost up so that way they can get more money. Increase availability of primary care. So, like family care, care for kids, stuff like that. I mean, yeah, there's not a whole lot of primary care doctors. That is true. That's because there's a bunch of caps and stuff on it. He wants to remove those. I think, yeah, I mean, I can agree with that. He wants to, he wants to cover maternal, mental health, reproductive, dental and vision, as well as other types of care under comprehensive care. Like, okay, but you know what will be better instead of expanding on comprehensive care and keeping around private insurance companies? Just go ahead and get rid of them and implement Medicare for All. That's all you gotta do. I mean, Bernie lays it out. You can see every other developed nation is able to do this without a private health insurance provider. Why do we need it? Why do we have to be the exception to that? Give more choices to employers and employees to get healthcare burden off of their back. Again, you want to know how you do that? Get rid of the private health insurance companies. We don't need Blue Cross Blue Shield. We don't need Humana. We don't need Aetna. We don't need any of the Guardian. We don't need any of them. They're pointless. It's just something to drive the cost up. That's all it is. It's 100% unnecessary. Full stop. Like, they shouldn't exist. Full stop. That's it. They should not be providing the care for us because they're focused on profits. And he's talking about making them more flexible. No, if you're going to have them, you have to be strict on them. So that way they can't, just pull the rug out from under you and fuck you over. They care about profits. You do not need a for-profit middleman when it comes to the lives and the health of the American people. You just can't do that. There's no point in that. There's no fucking point. It's evil to have these people exist, and you want to keep them around. Andrew Yang, you have my support. I think you're a great guy. UBI, it's not something I'm too educated about, but it's interesting. It's something new. I want to learn more about it so I can form an opinion on it. You understand what's going on with AI and robots and everything like that. You understand that if jobs are being taken away from us, and it's not by people from south of the border, it's by robots. You understand that's going to happen. So you want to provide for the American people, so when their job is taken from them and replaced with a robot, they're not going to go under. They're going to be able to stay afloat, and they're going to be able to provide for their families. I think that's great. I like the guy. But come on. Medicare for All is something everyone should support. If you can't support Medicare for All, you are not getting my vote, and you shouldn't vote for them either. You should not give them their vote, their support, anything like that. Me personally, I won't be donating to the Andrew Yang campaign. I donated once. Gave him $10 one day just because I had it and I felt like donating because, like I said, I like the guy. He's got a lot of great things. He's got a lot of great ideas. But this is something I just... No. But now he does continue on. He's talking about how Americans deserve better quality for end-of-life care. Which, yeah, it's true. They do drag out that process so that way they can make more money. I hate to say it, but it's true. So that's something I actually support. And he also refuses to hire anyone who formerly worked in the pharmaceutical industry. That's great. Lobbyists, fuck lobbyists. They're the reason that we still have the healthcare system that we do. If it wasn't for them, by now we probably would have Medicare for All. But, of course, they want to make money. Why would they care about the lives of the American people? They don't. They just want money in their pockets. They want their wallets to be fat. That's all they care about. If I get sick right now, and I go to the doctor, and it's $100,000, even with my health insurance, they don't care. They want me to pay. They're not going to care for me. They want me to pay. If I can't pay, oh well, I'm fucked. There's just no other way around it. I am fucked if something like that happens. Because I can't pay for a $100,000 surgery. There's no way I could do that. The for-profit health insurance companies are evil. They need to be taken out. They need to be gone. We don't need them. It's essentially a private tax, and it's costing us way too much money. And they're always talking about, we want to give people the choice. You cannot have choice with that system. Because you got to think, right now, if I were to go on vacation, let's say I just went down to Florida, if I got sick down there, I wouldn't be covered. If I got sick right now, I wouldn't be covered in a lot of places. I straight up just wouldn't. Because my healthcare just wouldn't cover it. I've got Blue Cross Blue Shield through my job. They cover some doctors. They cover most surgeries. They have decent copays. It's good health insurance for what it is, but at the same time, I know there's a better system out there. I can afford to have the healthcare that I have now, but the thing is, I know there's a better system out there, and I know Johnny down the street, he can't afford healthcare. He can't afford all the stuff that he needs. And you know what? I would be willing to help him out. If it ends up costing me more money under Medicare for All, I don't care, because now I know everyone gets the healthcare that they need. Everyone's covered now. I'd be fine paying more. I'm not going to pay more, but if I was, I'd be completely fine with it. When you break down the math, it is very simple. It makes you realize that the for-profit health insurance companies are not necessary at all. We do not need them. We don't. We will save money by getting rid of them and having Medicare for all and having everything covered with taxpayer money. It's free at the point of service. It would save us so much money. It would cost us more in taxes, but you gotta think, we're already paying a private tax. You eliminate that private tax, you negotiate down the prices of the drugs, and then you tax us more. Well, let's say we're paying $10,000 before. Okay? So, let's say we were paying $10,000 a year with all our premiums, deductibles, and all that. And that's what, on average, we were paying. Well, let's say all of a sudden I hand you that $10,000 back, but there's a charge of $5,000. You still end up with $5,000 in your pocket that you wouldn't have had if you had kept the previous system. If I never handed you that $10,000, I mean, you wouldn't have that $5,000. Yeah, it sucks that you lost half of it, but I mean, at the same time, that's $5,000 that you didn't have 20 minutes ago. Now you do. The math makes sense. If you don't support Medicare for all, then you're evil. That's it. That's all it is. I mean, how can you sit there and say that our current system is okay when 500,000 people have filed bankruptcy because of health insurance? They weren't able to afford their care. 30 to 45,000 people die every single year due to lack of health care. You can think of stories all the time. There's just a story the other day from one of Bernie's town halls. This homeless vet was at one of his rallies in Nevada and said that he wanted to kill himself because his TRICARE got taken away, and he's a Navy SEAL. You know, he's a veteran. His TRICARE got taken away. He couldn't afford his procedures anymore, and he was in stage 4 of like Huntington's disease, I believe it was. $140,000 is what it would cost him. He couldn't afford that. So he was going to kill himself. He didn't want to deal with it anymore. And Bernie said, fuck no, you're not going to do that. He talked to his local senators and everything like that, got everything situated. Now he's back on his health care, and everything's just fine. There was a story the other day of this woman. Her husband is extremely sick, and you saw that it was going to cost them $18,000 a year. The best coverage was going to cost them $18,000 a year with a $13,000 premium. And it was going to cost them over $1,500 a month. That is sickening. The fact that that's even a reality. Like, if you go talk to someone in France, Canada, Sweden, the UK, any place like that, you go talk to them, they're horrified by what we have to deal with. Like if I were to text my buddy in the UK, be like, hey, so when you have to go to the ER and you have to take an ambulance, how much does it cost? They're going to be confused. They're going to be like, wait, what? The ambulance is free. I don't have to pay for it. And then they ask me, and I say, oh yeah, it's going to cost like $2,000-$3,000, somewhere in there. And they're like, wait, what? That is insane. No other developed country has to deal with this. They don't. It's just, they don't have to deal with this. Why should we, the richest country in the world, have to deal with shit like this? We shouldn't. That's the thing. But politicians are corrupt. They take money from Big Pharma, so they keep the current system in place. It's fucked up. It is. It's a situation we are currently in, but you know what? We have the power to change it. That's it. We're the American people. We're a democracy. We have the power to change it. We just have to have the will. And that's why I support Bernie Sanders. I don't support Andrew Yang because he's backing off of Medicare for all.